I'm Chris Lockyear. I'm the Secretary General of Médecins Sans Frontières, or Doctors Without Borders. And my role is really sort of coordinating within a movement that spans the globe, and that ranges from our operations in the field, in the countries that we're working with, to the headquarters that we have around the world that support our doctors, nurses, and logisticians who are providing critical medical care for people in conflict and in natural disasters. I'm just back from Sudan. In fact, I've been to Sudan twice in the last few weeks. Sudan is one of probably the biggest humanitarian crisis affecting the world at the moment, probably the biggest humanitarian crisis that we've seen for decades. And yet it's a conflict which is relatively silent in terms of the media. The characteristics of this conflict are excruciating. I mean, I witnessed some of them directly. Just 2 weeks ago, I was in the Omdurman area of Khartoum. And while I was there was a shell, a rocket shell hit a market nearby. And within an hour, there were dozens and dozens of critically wounded patients in the hospital. This was a crowded marketplace. People were out shopping on a Saturday. And in the hospital, the emergency area, there was dozens of patients. I counted over 60 patients who needed critical care very, very quickly. The morgue in the hospital was overflowing with bodies. Bodies were being brought in and out as I was leaving. And this is just one illustration of what is a really brutal war on people. We're seeing a brutal disregard for civilian life. At the same time, we're seeing extreme levels of malnutrition. Around half of the population are facing acute food insecurity. It's particularly worrying at the moment in that the hunger gap period is coming up. So we've seen a drop in rates of malnutrition, but we know cyclically at this time of year it's going to rise. So there's a real race against time to get food into Sudan in general and Darfur in particular. And what we're seeing as we look at the humanitarian response in Sudan against this backdrop of this horrific conflict is a global humanitarian failure, because the collective response is nowhere near what it should be. It's complicated to work in this area. It always is complicated to work in a complex humanitarian crisis, but it's entirely possible to do it. And so it was a very frustrating experience to witness firsthand the gaps between the critical needs of the population and what we're doing as a humanitarian movement to meet the needs that are so urgently and visibly there. The gap is huge, and that's very, very concerning. What is needed in this conflict boils down essentially to 3 Ps: protect civilians, permit access, and provide assistance. It's incumbent on the warring parties to make sure that we're protecting civilians and that they're not at the center and they're not continuing to be victims of this brutality. That we permit access so that the warring parties, both the RSF and the Sudanese Armed Forces, are allowing humanitarian access in, and they're obliged to do so under international humanitarian law, especially when there is a critical humanitarian situation like there is now. And it's also incumbent on those who are supporting them, their allies, their supporters, member states, governments all around the world, including the UK, for example, to ensure that this happens. And then there's also the essential element of providing assistance, which means that humanitarian organizations, the United Nations, other international organizations, really need to be very brave in how they position themselves in this conflict, making sure they are pushing back on both political, bureaucratic, and administrative barriers there, which make it difficult. But the situation is so critical, it really requires us to take risks to ensure that we're getting aid workers onto the ground in all sides of this conflict, and actually having physical presence to be able to deliver quality humanitarian assistance. I mean, overall, if you look at Sudan as a whole, it's a country which has a desperate need for more healthcare before this conflict started, and that healthcare system overall has been depleted by at least 50% and much higher in the real active areas of conflict. And we have had to, many times in this conflict, leave hospitals, rehabilitate hospitals because of the fighting that was happening in them. Hospitals and health centres have been theatres of conflict in this war, and one of the messages that we're giving to both of the warring parties here is that they are protected. Health centres, health facilities are protected under international humanitarian law. They must be protected. They are a source of, they should be a source of sanctitude and recovery for people who've been directly affected. Now, we're still having issues in hospitals now. We recently had to suspend activities in the Bashir hospital in Khartoum because of violence happening there. But we are also now operating in 24 hospitals. We have operations in 10 out of 18, Sudan's 18 states. We have 42 health centres. We've treated over 7,000 people for trauma-related injuries and nearly 200,000 people in our emergency rooms, and something like 60,000 people for malnutrition across the country. So health centres have been at times the centre of this conflict, and at the same time there is life being breathed into a lot of these hospitals. As patients are coming back, they're incredibly busy, and so it is possible to start to rebuild the healthcare system, or at least provide the services that people need. A big factor in recent weeks has been the position of the US government in terms of stopping funding from US aid. There's been a huge need for scale up in Sudan before this happened. And resources, financial resources, people are a key part of that. And it's also political bravery. It's about taking risks. It's about ensuring that we can push back on some of those barriers. But it's also very clear that these positions that have come out of the US government have had a very immediate impact as well. I was in Khartoum as the news was breaking, and the authorities there were telling me that in the 2 days before we met, that 5 organizations had to suspend or stop activities. We've also been asked to take over activities related to food, sexual and reproductive health, and primary healthcare in Khartoum. In Yala, in Darfur, there's a similar picture where organizations have had to stop water trucking, providing water to displaced people, and they've had to stop outpatient care and nutrition care. I mean, we are in the fortunate situation in that less than 1% of our funding comes from government institutions, and we don't receive money from the US government. But the context and the ecosystem in that we're working is very clearly being very rapidly affected by these positions. And so it's very alarming for the providing this critical assistance, particularly when it happens in such a dramatic fashion. We're still trying to understand the implications now, today, and in the short term. I mean, what I would say is that continuing to provide humanitarian assistance to Sudan and many other countries that are in critical need is paramount. I mean, there are millions and millions of people around the world who are in need of humanitarian assistance, and we need, as a global community, to ensure that they can get that. We spoke to the UN Security Council about what our teams were witnessing in Gaza, and trying to bring essentially the daily reality of the people of Gaza and what it was like to be able to provide, or trying to provide, humanitarian assistance to a population who are under siege, were being denied humanitarian assistance, and facing the most brutal bombing that has left large areas of Gaza completely razed to the ground. And we were trying to bring that reality to the Security Council and the United Nations in New York. You know, we tried to paint the picture of what it was like to be able to treat patients in this situation. The fact that we were having to reuse gauze to pad wounds from one patient to the next, wash it out, and use it for another, which is, you know, a really horrific thing to ask any medic to do. The reality of the fact that one of our guest houses had been hit by a tank shell just a day before this intervention. So we were really trying to make this appeal to the policymakers. Of course, first and foremost, that at that time, that to be able to operate, we needed to call for a ceasefire. This was on both sides of the conflict, so both the Israeli side and Hamas, to ensure that first and foremost, people would not be being killed in the thousands that they were, and then secondly, to allow humanitarian assistance in. So it was really a desperate plea for that to happen. I mean, I hope it had some impact in terms of the general awareness, but this fighting continued for months and months and months after that. And so it's been a really deplorable and harrowing situation, first and foremost for the people in Gaza, but also for an organization trying to work in those conditions. The ceasefire that is there came far too late. That should be, that's something that the world needs to live with on its conscience, because many thousands of people lost their lives in that time when it became obvious that a ceasefire was needed, till there being one. We released a report just a few weeks ago, so in December, just before the ceasefire, where we talked about our teams seeing clear signs of ethnic cleansing in Gaza, particularly in the north, and that we were seeing elements of genocide that were happening there through the eyes of our team. We also were clear that as a medical organization, we're not able to qualify intention around a genocide, which is a key element in terms of its qualification. But we did this because what our teams were witnessing on a day-to-day basis, including the denial of humanitarian assistance, was so extreme that we needed to talk about what we were seeing as well as being able to provide assistance. And that's a difficult equation for us, because we don't want any repercussions towards our team, towards our operations. We want to continue those. At the same time, we feel obliged to talk about what we're seeing. We're now in a situation where there is a ceasefire. It's a fragile ceasefire. First and foremost, we need that to continue. We also need to make sure that we are not being dogmatic about what we see. And I say that because one of the characteristics of this conflict, particularly at a political level, has been the notion of counting trucks coming into Gaza. It has been at some point used as an excuse for continuing the war, as in trucks are coming in, aid is coming in, the war is okay to continue. Now, firstly, providing humanitarian assistance, any humanitarian assistance, but particularly medical assistance, is much more than supplies. Supplies may be the backbone, an essential backbone, but you also need to be able to have doctors and nurses and logisticians to be able to treat patients. Now what we're seeing is, since the ceasefire, the number of trucks going across the border has gone up significantly, but we're still struggling to get in what we would call strategic items, which actually are very basic items in many ways. Autoclaves, for example, which are used to sterilize surgical equipment, are not getting in because they're seen as what's called dual use, and that they could be used for other purposes. I would say that an autoclave is an autoclave. We need to be able to sterilize surgical equipment rapidly and quickly. And we still have 14 containers stuck in Amman that we haven't got into Gaza, which are there to set up a field hospital. So we need to also, this isn't, the humanitarian supply problem hasn't gone away now there's a ceasefire. Some elements of it have improved, but at the same time, critical elements for providing quality medical care are still missing. It's going to take generations for the population of Gaza to recover physically. There's a whole generation of people who are going to be growing up with major physical disabilities, and mentally as well. One of our psychologists told me when I was in Gaza in March, there's no such thing as PTSD in Gaza, post-traumatic stress disorder. It's OTSD, ongoing traumatic stress disorder. And for me, that really resonated in that there's no, even with the conflict, even with a ceasefire there now, if we flood Gaza with aid, then it's going to still take generations and generations to recover from the situation that we're in. The World Health Organization, WHO, estimates that something like 12,000 people require medical evacuation to receive the sort of level of complex treatment that they need, which they can't get in Gaza. And so this is, from a humanitarian perspective, this is not over. It's going to require a huge collective effort for years to come. So we've also been trying to support with medical evacuations for critically wounded patients from Gaza, and we've been able to do that with a few. We've been able to do that with a handful of patients. Essentially, the difficulty to get patients out of Gaza to treatment is incredibly hard. There's barriers thrown up at every step. But I managed to visit our. We have a reconstructive hospital in Amman, which serves the region for critical cases. That provided also a chance to talk to people in a way that you don't necessarily get to when you're racing around Gaza or Sudan or somewhere like this. And I met a father there with two kids who had both received horrific burn injuries in Gaza, and they'd managed to, after a great ordeal, make it to Amman. And they were telling me about their story, and the daughter was telling me about how she used to have two other brothers, and the family got split apart by one incident of bombing, and she told her brother to not leave the family, and in that process he was killed. And so, as well as her physical injuries, she was struggling with guilt for something which clearly was not her fault. And at the same time, their father was telling me about how he'd also lost his wife and two other children. And his parting words were, she took two for herself and left two for me. And this is one story of many. This is a normal story for people in Gaza, and we need to remember that there are hundreds of thousands of people living like that on a daily basis, and we need to continue to not just provide medical assistance and humanitarian assistance to them, but empathy and care as well. MSF's independence is crucial for us to be able to carry out the work that we do, to make sure that we can prioritize going to places where the needs are the greatest. And we have 7.3 million donors around the world that enable that financial independence. We are 98% privately funded, which is an incredibly fortunate position to be in, but it also has direct impact in terms of being able to treat the people who are most affected in Sudan, in Gaza, anywhere around the world. But there is a strong notion of solidarity for people all around the world. I think a lot of the tone that we hear in the media now is about closing doors, is about putting up barriers, it's about preventing boats. It's a very obstructionist narrative. But actually there is a lot of evidence to the contrary as well. And the way I like to see our donors is not transactional. It's a partnership. It's a sign of solidarity. We are in this together, trying to do this for people around the world, many of whom we will never meet, but they are mothers, fathers, children, just like all of us. And that's how I like to see our donors, as a contribution to that effort. And it's an incredibly valued contribution that we have, because we can't do what we do without it.